The lower overall numbers, though, coinciding with the Thursday announcement by the governor concerning the vaccine program. Here's O.N.R's Jason Doyle.
With the backdrop of COVID numbers trending in a better direction, Governor Kevin Stitt announced COVID-19 vaccinations will begin for the next priority group later this month.
Teachers and school workers of all ages, as well as Oklahomans with comorbidities, will be eligible for the vaccine starting February 22nd. That's a week from this coming Monday.
We've made significant progress in vaccinating Oklahomans over 65. We feel it is the right time to begin vaccinating more of our at-risk population.
As public health officials begin preparations to add a new group, Oklahoma Health Commissioner Dr. Lance Fry is asking for people to sign up.
For those individuals in these next priority groups, we encourage you to sign up through our online portal in the next 10 days. If you haven't done so already, just to ensure that you are notified when you become eligible for the vaccine.
We estimate there are 89,000 Oklahomans who qualify as teachers and staff, and just over 1 million Oklahomans with comorbidities who will qualify during this period.
The health department will coordinate with school districts across the state to find out what their specific needs are before setting up pods to vaccinate teachers and staff.
Teachers and other school employees in our state are now set to get a vaccine long before the end of the school year.
State Superintendent Joy Hoffmeister, who also serves as the chair of the OETA board, welcomed the news, releasing a statement that read in part, "Ensuring the vaccination of teachers is vital to keeping school doors open. I urge all Oklahomans, teachers and non-teachers alike, to welcome the vaccine as soon as they are able."
Our goal is to ensure that any teacher who wants to receive COVID-19 vaccine has the opportunity to do so by spring break.
As vaccine supplies increase, the state will begin to distribute them to more traditional healthcare settings to increase access for the population with comorbidities. Officials say they are able to take this next step because of a moderate increase in the number of vaccine doses coming to Oklahoma and reaching a significant benchmark within the 65-plus population.
We're around 45% of that population that is represented in our database, but when we check with our partners that are receiving federal allocation, including tribal partners, and then through the Veterans Administration, that number goes up to around 56%.
Moving to the next phase of the state's vaccination plan comes at a time when the federal government is starting its pharmacy vaccination program, adding resources in Oklahoma.
We're also participating in the new federal retail pharmacy program, which will provide additional doses to over 70 pharmacies across the state.
Oklahoma is gaining ground in the battle against the pandemic.
Our cases are down 59% from their peak last month, and hospitalizations are down 56% from their peak.
There's been a tremendous drop nationwide in the total number of new COVID cases daily, and Oklahoma has seen a very substantial drop in the number of cases.
OU Health's chief COVID officer, Dr. Dale Bratzler, is cautiously optimistic about the recent downward trends.
Oklahoma currently has 56 cases per 100,000 population per day, which is third in the nation. However, just remember that on January 12th, we were seeing 103 new cases per day on average.
However, COVID-19 is still a threat throughout the state.
Across the state, we've seen substantial reduction in the number of new cases, but there is still rural spread of the disease that we need to be cognizant of.
Bratzler adds the death rate is not following the downward trend of the other COVID indicators.
We're still seeing quite a few deaths, but remember, some of the people who get really sick with COVID-19 are in the hospital for weeks before they die. And so I think we'll continue to see the number of new deaths in the state can slowly continue to come down, particularly if the hospitalization rate stays low.
Commissioner Fry says Oklahoma is not alone in the death rate continuing at a higher pace.
It's a statistic that lags, and so we're still, and it's not just in Oklahoma, it's nationwide. They've been on multiple calls with the Government Association, et cetera, talking about how everyone is seeing the trends coming down, but their death rates are still high right now.
For now, officials believe things are getting better in Oklahoma. Johnson & Johnson is likely to receive emergency use authorization soon, meaning a larger supply of vaccine doses coming into our state. But there are some factors that public health officials and scientists are keeping a close eye on. COVID-19 variants, which may spread easier, be more resistant to treatment, and have a higher mortality rate. The first of which have recently been detected in Oklahoma. Jason Doyle, The Oklahoma News Report.